Good morning, everyone. All right, so today we're going to be working on hip mobility, some spinal mobility, really trying to open up the spine, open up the hips. We're going to finish with some glute, really low-level glute activation, really one of the most powerful and impactful glute activation drills that you can do on a daily basis. Super simple, very effective. Let's go ahead and get started. We're going to start in a standing position, getting into our crocodile breath. So making nice big C shapes with our hands, thumbs in that low back musculature, index fingers wrapping around into the front abdominal musculature, palms pressing into that side body musculature. Hands are below that rib cage and above the hip bone in that nice meaty section of the abdominal wall. On our exhale breath, I want to let the hands kind of clench down so that we can create good resistance for that inhale phase. And I want to think like we're blowing up a balloon with that abdominal wall. So nice slow inhales, start small, and with each exhale on your next inhale, see if you can expand a little bit bigger. We're going to do about 6 to 8 nice slow breaths. Think 5 to 8 second count on inhale and on your exhale. So with each inhale breath, we're seeing if we can expand a little bit wider. As you exhale, draw that navel up and into the spine. Nice inhale in through the nose. Exhale out through the mouth. Make sure shoulders are remaining fairly soft. I don't want to shrug and then hold that shrug on that exhale. If you feel the shoulders tense, let them soften on the exhale. And start to notice, is there balance, symmetry in that breath? Can you feel equal press in that inhale, pushing out in the thumbs, in the palms, and in the index fingers? Is it even in all directions, or do you notice one side doesn't move quite as much? My right side moves a little bit more. My left side is a little bit less expansive, especially in my left thumb area. So we'll come back at the end of class after we get some mobility in and see if that improves. Go ahead and let the hands drop down to the side. We're going to spread the hands wide as you can, really opening up the fingers. See if you can feel some stretch within the palm of the hand. We're going to spiral the hands up towards the ceiling, and we're starting with some simple bowls of soup, starting one hand at a time. I want to think about spinning through the entire long arm, spiraling internal, turning that thumb down. Feel that humerus spinning inside of the shoulder socket as far as it will go. See if you start to feel some stretch or pull. As we open up, same thing, opening up as far as you can. Feels a little bit of light stretch and pull. And then same thing to the other side. Going back and forth. I want to feel that we're really working both as much internal rotation as we can get and then as much external rotation as we can get without going into pain. If you have some minor clicks or clunkiness, it's okay to move into that noisiness as long as it is not painful. I want it to try to be as smooth as possible. As we are getting into this, we can start to level up our hands a little bit, bringing them closer to shoulder level. Again, making sure that we're not getting into any pinch or pain. Actively keep those hands spread, fingers spread. Feel that stretch through the palms. Actively keep the elbows extended. Don't let them get soft and bendy. And we'll continue to kind of level up the arms until we get to shoulder height. As long as it's not painful. If you start to get a pinch, keep the shoulders below that level of the pinch. Once we get up to shoulder height, We're going to move and continue to internally spiral so that we start to feel that shoulder blade round up and roll over the top. And then we're going to bring it back down to the other side. As we're moving, spiraling through the long arms, actively start reaching away like you're trying to touch the walls at either side. See, imagine that you're trying to create some traction and open up, like you're trying to create gapping space at the shoulder and the elbow and the wrist, even out to the fingers. Let it start to move your spine all the way down to the hips. See how much roll can you get in that shoulder. Bring it back up, going all the way across to the other side. We'll let the hands relax. We're now going to grab our staff. Going to get a shoulder width grip on the staff. Imagine that we're trying to bend or break the staff. Want that bend to happen at the wrists and the elbows. So the elbows are going to be spiraling up towards the ceiling, as well as shoulder blades. Shoulder blades are spiraling down, moving towards our back pockets, keeping the staff in front at the moment, getting back into that breath. Inhale into that belly, feel that crocodile breath. Exhale, draw the navel up and into the spine. We're going to add in some pelvic tilts. On that inhale, allow the pelvis to tilt forward so that we get some sway in the back and the belly kind of opens up in the front. Exhale, drawing that navel up and in. As we scoop, feel that excessive scoop. You may get some stretch into that low back. Want to make sure we're not moving into pinch or pain. Keep that staff actively bending, so the shoulders should have some level of tension from engagement through the staff. And with each one, we're seeing if we can get a little bit more movement in that pelvis in both directions. Or how much can you tilt, getting that sway in the back? How much can you scoop, feeling some stretch in the back and some contraction in the glutes? On your next inhale, as we're opening up that belly, when we exhale, strong scoop, and at the same time, start pulling the elbows up towards the ears. Inhale, hips go forward, belly opens up, shoulders roll, soften just a little bit. Exhale, squeeze those elbows back towards the ears. As I pull those elbows back, I want to actively be scooping. I don't want to lose that scoop to where that rib sticks out and the belly opens up. I want to keep that scoop. Core should be kind of lightly engaged at the same time that we're pulling elbows back. After about 10 reps, we're going to pull into light tension, and we're going to hold those shoulders in light tension. And from here, we're working elevation and depression of the shoulder blades. So we're reaching the shoulders up, letting them move up to the ears, and then pulling shoulders down towards the hip pockets. Exhale as we push. Inhale as we pull. And as you pull, don't bend the elbows. Keep those elbows actively straight, actively pushing. You're pulling from the shoulder blade, but you're still pushing through the arms, keeping those arms actively straight. On the next push, as your shoulders elevate, keep them elevated. And we're going to come back to pulling those elbows back towards the ears. Inhale forward. Exhale, scoop as we pull back. With those shoulder blades elevated as we do this, we should get a little bit more range of motion. But again, I want to make sure we're not moving into pain. Uh, Also pay attention to the head on this. I don't want the head to push out and forward. I don't want to extend the chin. It kind of helps to pick a spot on the wall out in front and keep your eyes on that spot. But really, I want to keep the spine tall on this. I don't want that head protruding out. We'll go ahead and drop the hands, and we're going to move the staff to behind the body, palms facing backwards, continuing to spiral, like we're bending that staff away from the body. So elbow pit should still spiral forward. Chest is going to open up with the shoulder blades packing down and back. Nice inhale into that crocodile breath. Exhale, lift the elbows up to the ceiling slowly. Inhale, let them soften. Notice if one shoulder feels a little tighter, more restricted than the other. Want to make sure we are not moving into stress or pain. As we're getting this light pull, continue to actively try to bend that staff like you're trying to break it away from the body. I want to feel that spiraling through the elbows as we're lifting. That will help to continue to open up the chest as we pull. Once we get about 10 good reps, we're going to flip our hands. Palms are now facing forward. We're still actively bending the staff away so that we have that nice open chest. Inhale into that crocodile breath. Exhale, lift and slowly squeeze. On this one, I want to pay attention to that front of the shoulder. Is one side a little tighter, more restricted than the other? That's going to be an important assessment point. We can also kind of check in with the neck. As you pull, very lightly check blind spots. You can do some light tilt and lift with the ears. Noticing, is there a relationship to the neck into that shoulder, one of the shoulders? Is it more tight on the left side or the right side? I want to be light with the neck. I'm not being heavy-handed with it. I'm not forcing it. Just seeing if there's a relationship between the shoulder and the neck. We'll go ahead and bring the staff back to the front of the body. We're now going to get a nice wide grip on the staff. And we're going to see what is our range that we can go with wide, keeping both hands on the staff, bringing it up to the head, and if we can, moving it back and to the back side of the body. Where you find it's tight and restricted, we're squeezing into it lightly and bringing it all the way back to the front of the hip. If you're able to work all the way through and around to the back of the hip without letting go of the staff, then great. That's kind of what we want to hope to get to. I want to avoid walking it through. So if the shoulders are stiff and the only way to get through is doing one arm at a time, I want to avoid that. I want to move up into that stiffness, squeeze into it, and bring it back. And just slowly keep working on that range, seeing if we can get a little bit further on each one. We'll go ahead and set the staff down to the side. Now we're going to come down to the floor. We're going to get into our quadruped position, spreading fingers nice and wide, grounding the palms fully. Toes are tucked. Want to have those toes nicely tucked. We're going to do a little bit of light foot mobility. We're going to inhale into our wrists, feel a little bit of load into the wrist. Exhale, feel the weight of the hips sink into your heels. I want to specifically feel that weight loading into the big toe joint. Feel it lightly stretch into the toe and into the arch of the feet. Inhale brings us back, loading into the wrist. So we're kind of mobilizing the wrists and the big toe at the same time. So as we load the wrists, Notice if one wrist feels a little tighter and stiffer than the other. As we load into the big toe joints, doing the same thing. Which is one toe stiffer, more restricted, achy? Is it painful? If it's painful, then I want to move into it very lightly. I don't want to force it. Get a good 10 nice slow reps. Then we're going to let the heels roll out, trying to get tucked underneath all the way out to that pinky toe. Try to get that pinky toe tucked underneath so that as we sink back, we can get some light load and stretch and try to feel some of that stretch into the lateral arch of the feet. Inhale, still coming into the wrist. Exhale, slow sink into the arches of the, into the lateral toes of the feet. On the next one, as you sink hips to heels, we're going to go to light tension, not heavy tension. And from here, we're going to do windshield wipers with the heels, rolling them all the way back to the big toe joint and then back out to the pinky toe joint. Just moving back and forth. Again, notice, does it feel tighter and stiffer on the right foot, right big toe than the left? Do you feel it more out to the lateral toes, like the pinky toe on one foot more so than the other? My left big toe is a little, ooh, that might help, stiffer, tighter. And that did help just a little bit, a little pop and adjustment in it. Let's go ahead and untuck the toes. I want to do a little bit more of that nice sink back, hips to heels, but now we're kind of feeling into the knees as well as the front of the ankles. Inhale, coming back to those wrists lightly. Exhale. How deep can you feel your hips sinking to heels? Can you touch? Or is there some stiffness at the knees that's preventing you from getting all the way down? Is that stiffness in the knees greater on the right knee or the left knee? We can use this to kind of assess if there's some inflammation or swelling in the knee joint, which would be important to kind of pay attention to. If you're able to get hips all the way to heels, we can start to rock all the way back, loading hips to heels, as long as it's not painful on the knees or on the ankles. Rock all the way forward and then all the way back. How does this feel in the front of the ankles? Does one ankle feel tighter than the other? Is there space between the ankles and the floor? Are you able to get those ankles flat, or is there space? And is there more space on the right ankle compared to the left ankle? Again, these are going to be helpful in kind of assessing mobility differences on one side, which would be connected to some imbalances in our gait mechanics. So I'll kind of want to notice these things. Coming back into our just starting point, quadruped, tucking the toes again, getting into our crocodile breath again, breathing into that belly. We're going to go with some pelvic tilts. So as we inhale, I'm letting the pelvis tilt to the floor, belly's opening up to the floor, nice big sway in the low back. Exhale, pull that belly button up to the spine as we scoop. Inhale allows the belly to drop to the floor. I'm keeping this movement at the pelvis and the low back. I'm not doing a full cat-cow just yet. I want to feel that mobility in the low back. Notice, how does it feel on the inhale? Is there some pinch? I want to stay shy of any kind of significant pinch or pain. As you exhale and scoop, are you getting a stretch, or are you also getting a pinch? Which direction feels like a bigger stretch? Which direction feels a little bit more stressful than the other. Again, I want to make sure we're not moving into a stressful or painful position. So if you're feeling one direction is a little stressful, stay soft with it and easy. Next, we're going to continue to scoop, and we're going to allow that movement to start to move up the rest of the spine. As it gets up to the shoulders, we're pushing. We're going to allow that movement to continue to go up over the top of the head. And we're going to try to touch our tailbone and our forehead at this imaginary point right here in the middle. See if you can feel your core light up on fire. And then inhale. Pelvis tilts to the floor, moves up the spine. As it gets to the sternum, we're reaching our sternum down to the floor, and the head comes up last. Nice, slow wave of the spine is what we're going for here. Can you start that movement at your tailbone and feel it move up the spine one vertebrae at a time? And the head moves last. Good. All right, we're going to switch positions, getting into a nice RV sit, getting as wide as we comfortably can. Actively reach the back of the knees down to the floor. Actively pull the feet like you're trying to touch your the top of your foot to your shins. Hands come down behind the hips, grounding palms. We're going to spiral those elbows out and away. Feel the shoulder blades packed down and back. Nice opened up chest. Tall spine lifting up to the ceiling. We're going to do our bowls of soup or spirals through the legs. Focusing on the kneecaps. Let the kneecap spiral out and away like you're trying to touch to the outside floor. And then spiraling the kneecaps in like we're trying to touch inside on the floor. Reason I want to focus on the kneecaps is it's easy. If I focus on my kneecaps and my kneecap is moving, I'm getting greater movement in the hip socket. If I move my foot, I can move my foot without my knee moving, and I can get very little movement at the level of the hip. So I'm not trying to touch the floor with my foot. I'm trying to touch the floor with the kneecap. Exhale on both directions on this. As you're spiraling out, we're exhaling. Inhale as we come to the center. Exhale as we spiral in. Now we're going to start to add in some ankle circles. As we spiral the knees out, we're then going to point the toes, like we're trying to reach the toes to the wall, out to the edge of the room, spiral the knees in, and we're pulling the toes back towards the shin as we spiral the knees out again. I want to have as much of that spiral tension as we can get as we're pointing the ankles or the toes. This should create some kind of like a flossing effect through the ankles. I want to make sure that we're not getting any kind of Charlie horse at the arch of the foot, any kind of cramping sensation. So if you are, want to go light at the level of the foot. If your feet feel pretty good, we can add in, as you're pointing, start to flex the toes like you're trying to grip. As we spiral back, we're going to spread and open the toes. Once we get a good 10 reps in one direction, we're going to reverse directions, doing all the same things. I want to try to keep as much of that tension through the hip, down into that ankle so I can get as much of that flossing effect as possible. Good. All right. So now we're gonna stay in V-sit just a hair longer. So I'm gonna get a little bit of work into the back line of the leg. So I'm gonna bring hands off the floor. Nice inhale breath. I want to kind of keep that active knees, active feet. And on our exhale, we're going to do some light folds, letting those hands slide forward on the floor. Inhale brings them all the way back. I want to keep the spine long and tall. So I want to watch out for reaching the head or the chest straight down to the floor. I don't want to get this rounding in the back. I want to keep the spine tall. So I'm reaching up through the top of the head. As I fold, I'm folding from the hips and just letting the hands slide forward. The more I'm able to keep that long spine, we're going to feel this stretch a lot more through the back line of the legs. So this is where I want to feel it. Nice, slow exhale. Inhale as we come back up. We also may feel this in our low back. So tightness in the back of the legs or low back is kind of the appropriate places to feel this. If it is tight, I want to be soft with it. I don't want to be forceful. With each one, we're seeing if we can squeeze a little bit further without forcing it. And now we can start to move a little bit off our center line, deviating a little bit more to the right side as we reach, and then a little bit more to the left side as we reach. Try to keep your hands square with your shoulders. So as you reach to one side, you're turning your shoulders with your hands. And we can continue to open it up, moving more and more wider, getting out to the heels. Notice how this feels on the right side compared to how it feels on the left side. Is one side a little tighter? Do you feel it more on one side in the low back? Do you feel it more on one side on the back of the hamstring? As we really get reaching out to one side, if we're keeping those shoulders square, you may also feel some stretch to the opposite adductor. All of those are important and useful assessment points. We're going to come back to our center, and I'm going to change things up just a little bit. I'm going to allow those knees to be a little soft. So instead of actively reaching them down, you can let them be a little bit of flexion in them, have a little bit of a bend. We're going to come back to our forward folds. Having them bent means you might get a little bit more reach. You might get a little bit more stretch into that low back. And we can start to get off that center line again. Reaching side to side, going through all the same stuff we just did. The only difference is we're keeping those knees a little softer. Again, keeping that knee a little bent, we should be able to reach a little further. Again, I want to make sure that we're keeping that nice tall spine. The knees being bent should change where you feel that stretch. You might feel it higher in the hamstring. You might feel it more in the low back area. You'll probably feel it less in that opposite adductor, although you may still get a little bit of that stretch as well. All right, so now we're going to switch to our shin box position. I'm in my left side shin box. Left hand is down, grounded to the floor. Elbow is spiraled out and away. Shoulders downwardly packed. Chest, sternum's tall, tall spine. Weight is a little shifted over so that back hip is off the floor. Don't want to try to keep that hip down. Starting with our knee openers. Nice slow lift of that knee to the ceiling. As we lift that knee, Try not to let your shoulder turn with that knee. I don't want that chest to open up. I want to try to stay still as we can through the upper body as we open that hip up. Inhale, bring it back down. Notice where you feel this. Do you feel it more outside front of the hip? Do you feel it more in the adductor, especially as we get to this top point? Maybe you feel it more in the glute. Notice how high the knee travels. How much range of motion do you have on this side? And then we're going to slowly windshield wiper across to the other side. Grounding palm, spiraled elbow, packed shoulder, tall spine. Weight is a little bit shifted over. Doing the same thing. Nice slow exhale as we lift. Inhale as we bring it back down. Again, avoiding rotate, letting that shoulder rotate open. Want to keep that sternum in the same spot. Again, notice where you feel it on this side. Do you feel it more in the kind of top front of that hip? Do you feel it more in the adductor, especially as you're opening up? Or do you feel it in the glute? How much range of motion? Is it more range or less range than the previous side? This hip is tighter. I don't have quite as much range of motion, and I feel a lot more stretch through the adductor, especially right here, kind of going into the hip flexors. Once we match our reps on this side, we're going to slow transition back to the other side. Again, grounded palm, spiraled elbow, packed shoulder, tall spine. Back hip is off the floor. This is where I want to bring that inhale breath, filling up that back bowl. Let that back bowl, imagine like it's a weight of that breath, like a bowl. You're filling up a heavy bowling ball, and that bowling ball drops down, reaching that hip towards the floor. Can it touch the floor? Kind of notice how close it gets to the floor. As we exhale, we're lifting it up, moving that hip forward, and actively scooping the tailbone so that we get some stretch through the front of the hip. Inhale, fill that back bowl up. Feel it reach to the floor. Now, what I want to avoid on this is I don't want to shift my weight to push that hip down. I want to keep my weight forward on the opposite hip. So I'm seeing, do I have range of motion to reach that hip back without shifting the weight? And exhale, how much can I scoop coming up at the front? If you can imagine your sacrum is the palm of a hand, your fingertips would be your tailbone, and I want to reach that tailbone forward, like I'm trying to touch something with the tailbone off in the front of the body. You can even have that hand right there, like you're trying to reach your tailbone towards your hand. Give yourself something to reach forward to. Notice can you get that light little stretch that you feel good and juicy? And the more we get that light stretch in the front, we should also start to feel the glute tightening up and contracting in the back. I want to get as much of that glute contraction as we can. Once we get about 10 reps, we're going to slow transition across to the other side, doing the same thing. Grounded palm, spiraled elbow, packed shoulder, tall spine, weight shifted. Inhale, fill up that ball, let it drop into that back hip. Exhale, hip lifts, reaches forward, actively scooping that tailbone. Again, and I reach and touch my hand lightly in front of my hip. Inhale, how close does this hip get to the floor? How much can we get that extension and feel that light stretch? And how much contraction can we get on this side? And is it different? Do we have less range of motion? Do we have a greater or lesser stretch at the front? Do we have more or less glute contraction in the back? Again, all of these are assessments for differences between the right side and the left side, which would indicate some imbalances in our gait mechanics. Once we get 10 reps, we're going to slow transition back to the other side. We're going to do the exact same movement with that hip, but now we're going to add in our reach with rotation. So inhale into that back hip bowl. Exhale, hip lifts, scoops forward. I want to feel that stretch, and I want to feel that maximum contraction of the glute. Lock that hip in, and then we're reaching out. Spread the hands, spiral the palm up to the ceiling, and extend that elbow. Feel that shoulder rotate. You're trying to reach that shoulder and hand towards that wall. Inhale, we're unwinding it, bringing it all the way back into that back hip. Exhale, lock in that scoop, spread hands, spiral the palm up, extend the elbow actively and full, and then reach and rotate. So we're winding up, creating tension, and then we're unwinding as we bring that breath back into that back bowl. Can you feel that wind, tension, spreading the hand, tension, extending the elbow, spiraling the palm up, and then rotation. We already have tension in that back hip. So can you feel that stretch start to move into that low mid back area, even up towards the shoulders? And then we'll slowly move back to the other side. Grounded palm, spiraled elbow, packed shoulder, tall spine, weight shifted. Inhale into that back hip bowl. Exhale, lift, scoop, actively get that contraction in the glute. Spread the hand wide, extend the elbow out, reach, and let that shoulder rotate like you're moving it towards the wall. Inhale, unwinds it, brings it all the way back into that back hip bowl. Exhale, actively scoop, locking in the hip first. Get that contraction, spread hands, extend elbows, actively reach that shoulder. Oh, this side's a little tighter. My left hip is tighter in this position. And I can feel how that hip is related to tightness in my rotation in my low back in this direction. I have better mobility on the other direction than I have in this side. And where you feel there's a limit or lack of mobility, I want to be soft. I don't want to force it, but I do want to add slow, intentional mobility. I want to feed this movement. See if I can get it to open up a little bit more. Can I get a little bit more access to movement? Good. So we're going to switch back to the other side. Now we're going to get into our folds. We're going to start using the shin angle. So keeping shoulders square with our shins. Hands are going to be square with the shoulders. Nice inhale into that crocodile. Exhale, draw the navel up and in as we let both hands slide and reach forward. Inhale as we bring it all the way back. And just like with our V-sit folds, I don't want the head of the chest to drop straight down. I want to keep that tall spine, hands sliding. We'll do 5 of these on each side, and then we're going to start working kind of more side to side. Each one, we're seeing if we can get a little bit more reach. Inhale brings it all the way back. Once we've done 5, we're going to switch to the other side. Again, square with the shin, shoulder square, hand square. Inhale into the crocodile breath. Exhale into that nice slow fold. Inhale brings it all the way back. Now notice if this side feels more challenging. Is it harder? Is it stiffer? Do you feel a greater stretch? I feel more stretch in the right low back and into this right glute on this side than I did on the other side. Once we get 5, we're going to start working side to side. So we'll get our nice slow windshield wiper going back to the other side. I want to continue to work with the shin angle today. I want to try to keep this knee angle fairly open. So there's a difference between an open knee, and as I pull that knee in, that's a closed knee, right? So I want to keep that knee open. I want to try to keep that knee angle at a 90 degrees. This is going to get into some different areas into the glutes than we would if that knee is more closed. Most people, when doing kind of the shin box folds, that knee naturally closes because it's a little easier, allows us to get into that fold. The more that knee is open, will make getting into that fold a little more difficult. So try to keep that knee angle open. We're fold as we reach, trying to keep the shoulders square. It's okay if you feel a little more limited in that range of motion. We're going to windshield wiper all the way across to the other side. Again, make sure that knee angle is 90 degrees in the front. Nice slow exhale. Trying to keep the shoulders square to the floor. It's harder to do on that side for me. Notice if one side's easier than the other side. Left side shin box, way easier. I don't have the same level of tension as I do on this other side. So this hip, really more my low back on my right side today are my limiting factors. Again, continue to check that knee angle as we fold. That side's really difficult today. Once we get a good 5 reps back and forth, we're going to start to open up that shin angle by letting that back leg slide a little bit. Again, I want to try to keep as much of that 90 degrees through that front knee. Again, the more we keep that 90 degrees at the front knee, and if we're able to square that chest, we're going to move that stretch in the glute a little higher up and get into some fibers of that glute that sometimes get missed out when we're doing our folds. So maintaining that open knee, each one we're continuing to slide that back leg a little bit further back. And we're going to open that back leg up more and more until we get closer to a yoga class pigeon pose. I'm not super concerned with that end range pose. If you cannot get that leg full back, I'm not overly concerned about it right now. Although we're moving towards it, we're working on improving it. I'm not going to force it. If you are able to get that leg to slide back, I want to continue to keep that front knee angle open, which means that as you try to fold, you might find that you're limited. It's okay to lift the hips up at this point using your hands. You can kind of pick your hips up, let that back leg slide, and you're just simply softening the hips down into the floor to feel that mobility stretch without forcing it. And then we're going to let the hips come back down to the floor as we come out of that position to go to the other side. But again, I want to keep that shin angle open. Kind of helps to have the hand at your heel and a hand at your knee, and try to stay square around that shin as we slide that back leg back, lift the hips up. And then we can soften the hips towards the floor to kind of load those hips and then just rock back down to the floor. Do a few of those back and forth, as long as it is not painful. Again, I'm more mobile on this left side. Right side is a little less mobile, although it has loosened up a considerable amount just from doing this work. There are still some limitations. So I have a little bit of sensitivity in the medial right knee. This is the knee I've had 5 surgeries on. It's probably part of what's limiting my movement in my hip is some sensitivity in that medial compartment of the knee. All right. We're now going to come all the way down to the floor, laying on our back, and then rolling onto our side body. I want to keep the knees at 90 degrees, hips and knees at 90 degrees. And the shoulders are stacked. We're going to have the hands coming straight out in front. Our bottom hand is going to go across the top leg on that top knee. And really, I kind of want to let that top knee slide or hip slide forward so that I got a little bit of a ledge where my top knee is further forward than my bottom knee. So the top hand is going to go on top of the knee. My opposite hand is going to come across to my opposite shoulder. Head can kind of relax. If you need a bolster or a pillow to hold your head up to make it more comfortable, that is okay. Working to open up our shoulder and chest, but we're going to do so by using our eyes. So I'm going to start by checking my blind spot, looking over my left shoulder, and I'm going to continue to reach my eyes, trying to see as far over that shoulder, and that's going to pull that shoulder back. As it pulls back, I want to make sure I'm not letting my hips slide with me. I want to keep my hips sliding a little bit forward. That's why I want this ledge over here. I don't want that to lose that ledge. I don't want my knees to get even. I want to keep one knee extended over the other. So as we're looking back, use those eyes. How far can you get those eyes to look over your shoulder, opening that shoulder up? Inhale as we bring it back. Exhale. Nice, slow look over that shoulder. As you start getting into this, I want to make sure it's not painful in the back or the shoulder or the neck. If it's not painful, as you're looking back and you get to this end range, see if you can touch the floor with your shoulder blade. More than likely, you're not going to get to the floor, but I'm moving that shoulder blade now. I would start with the eyes, and then I'm reaching a little bit with the shoulder blade, and then bringing it all the way back forward. Open, feel that nice opening of that shoulder. You can feel a little bit of opening up into the chest. Can you feel that mobilization and stretch to the mid and low back? Once we get a good 5 to 10 reps, we can roll over to the other side. So again, starting hands straight out in front. Make sure the shoulders are nice and stacked. Knees and hips are at 90 degrees. That top knee is a little bit over the bottom knee. Bottom hand is going to come to the knee. Top hand is going to come across to the opposite shoulder. Nice inhale. As we exhale, we are looking over into our blind spot over our shoulder and continuing to follow our gaze, seeing how far can we look over that shoulder as that shoulder drags back. Inhale as we bring it all the way forward. Exhale. Nice. Start with the eyes, looking over that shoulder. Reach that shoulder back. As that shoulder's reaching back, I want the hips continuing to kind of lightly slide forward, or at least maintain that forward slide. I don't want that hip to slide back. I want to keep it sliding forward. as the shoulder's moving in the opposite direction. As you're getting into it, as long as it is not painful, we're starting with the eyes, looking over the shoulder. Then as you get as far as you can with your eyes, start to reach with the shoulder blade. See if you can bring that shoulder blade closer to the floor. Inhale as we come all the way forward. Notice if this side feels a little tighter and more restricted than the other side did. Good. All right. So now we're going to get onto our back. Legs are going to go straight out into front. So this is going to be, we're going to do a single leg hip activation. This is one of the most powerful hip activations that you can do. And it's powerful because it's subtle and it's easy. And I want to think about all we're really doing is sending neurology downstream into the hip, into the leg, all the way down to the foot. So starting from our back, we're going to slide one foot so that the foot comes flat to the floor, bending that knee. And we're going to move that foot out to about 45 degrees from the midline of the body. The foot to toes are going to kind of be turned out to that 45 degrees as well. I want to maintain a perfect tripod foot. I want to let those toes and the ball of the foot spread as wide as they can go. And I want equal downward pressure. I don't want to push harder through the heel. I don't want to push harder through the ball of the foot. I don't want to feel more pressure on the big toe and less on the pinky toe or the other way around. I want even pressure throughout that foot. We'll start with some just simple inhale and exhale. As you inhale, so I got my right foot down. I'm focused only on the right side hip. As I inhale, filling up that belly, allow that right side pelvis to turn up towards the floor, getting some sway in the back. As we exhale, feel that navel come up and in, pushing the spine towards the floor and lightly scoop that tailbone. Inhale, unscoops. Exhale, scoops. And as you inhale, that pelvis tilting forward is going to, or the front of the pelvis tilting up towards the ceiling is going to move the back of the pelvis to the floor. As we exhale, that pelvis is going to start scooping off the floor. I want to start to feel it reach up towards the ceiling. Can you start to feel some stretch through the front of the thigh? Inhale as we let it back down. Exhale. With each one, we're going to send that tailbone up higher. Again, this is where imagining the sacrum is the palm of your hand. Your fingers are the tailbone. As you shift your tailbone up, I'm trying to reach that tailbone to the ceiling. And with each one, if you're getting some stretch through the front of the hip, continue to move into that stretch. Can you start to feel some tension in the glute? If so, I want to try to maximize that tension. Continue to actively scoop. If you're feeling this more in the low back and less in the glute, it might mean that as you're scooping, that you're actually lifting your rib cage up. I want my rib kind of moving down towards the hip as the hip is scooping up. The more you're able to maintain that, the more we should feel that isolation in the glute. Now, as you're starting to get to that maximum level, I want to now keep that hip up high. We're going to come back to inhale, pelvis tilts so that the front of the pelvis is moving to the ceiling, the back of the pelvis is moving to the floor. Exhale, tailbone scoops up to the ceiling. So we're doing those same pelvic tilts, but we're keeping that hip off the floor. Opposite leg should be completely soft and relaxed. If your opposite hip is off the floor, that means you're using that opposite leg too much. Take that stress out of that leg. Turn it off. We're only working one side right now. That inhale to exhale at the very top. I want to continue to actively scoop. Feel as much of that stretch. Can you start to feel some greater contraction in the glute? And then I want to finish by coming all the way back to the floor and all the way back up into that contraction. I want to get a good 20 reps minimum on this, on each side. Really feeling that foot spread, grounded, nice scoop, stretch in the front, contraction in the back. Once we get a good number of reps, we're going to switch to the other side. So again, foot comes flat to the floor, moving it out to about 45 degrees from the midline of the body. Make sure the leg you just finished with comes back to inline. Don't keep it out and away from the body. I want it in line with the body. So you're at mid-level with that opposite leg. The leg we're now working is 45 degrees out. Starting with just that breath and light tilt of the pelvis. So inhale, lifts the spine off the floor. Exhale, draws that navel in and lightly scoop the tailbone. Inhale, lifts. Exhale, feel that belly button pressing the spine into the floor as you get that light little scoop. And with each one, as you exhale, allow that scoop to start to lift that tailbone up towards the ceiling. Let that hip start to come off the floor. And we're going higher and higher with each one so that we start to feel that light stretch through the front of the thigh. And as we move more and more into that front of the thigh, start to feel that contraction through the rear in the glute. As you're feeling that stretch, I want to move, squeeze into that stretch more and more. Can you feel that glute tightening up more and more in the back? I want to start to work in as much of that contraction at the very top. Again, moving that tailbone towards the ceiling. How high can you get that tailbone to scoop? Maximize that stretch in the front, contraction in the rear. On the next one, as we come to the top, we're going to stay top. Inhale, let the pelvis tilt towards the ceiling. Exhale, let the tailbone reach to the ceiling. Not letting it drop at this point. We're just keeping that tilt at the top, scooping up as we exhale. Front of the hip moves to the ceiling on the inhale. Tailbone moves to the ceiling on the exhale. Again, I want to feel maximum level of stretch and contraction without going into stress or pain. Can you move into that stretch lightly? Can you feel maximum contraction? Notice feet. Well, again, I want to make sure the feet are full or spread and grounded evenly. Big toe all the way out to pinky toe and heel. Even pressure from the front of the foot to the back of the foot and throughout the foot. Now we're going to come back and finish with full range of motion. Let that hip drop all the way to the floor. Exhale as we scoop. Maximum contraction at the top. Once we've evened out both sides, let that leg soften down. And now I very slowly want to roll Come up to a seated position. When check in, make sure we're not dizzy or lightheaded. We just spent a good amount of time on our back. As we're checking in, we're not dizzy or lightheaded. We're going to come all the way back up to our standing position. If you do feel dizzy or lightheaded, stay seated, stay on the floor. We're going to finish with checking with our crocodile breath. So making nice big C shapes with our hands, thumbs in that low back, index fingers wrapped around the front, palms pressing into the side, hands below the ribs and the hip bones in that nice meaty section. Inhale, feel that balloon being inflated, pushing out into the hands. Exhale, draw that navel up and in, cinch the hands down to create a little bit more resistance for your inhale. And we're going to do another 6 to 8 nice slow inhale and exhales. And notice the symmetry of that breath, especially the inhale phase. Has it changed? Do you get better expansion? Can you feel it moving in the areas it wasn't moving as well at the beginning of the session? Have a little bit better expansion. It's a little bit more even. It's still a little bit less on that left side, low back, but it's moving more than it did at the beginning of the class. And my mobility improved throughout the class. So my hips and my low back feel a little bit better than it did at the beginning.